first, we need to check the doctor's order. So before doing the assessment, we need to verify first what we need to perform.
Good evening, ma'am. I am Afil and I will be your student nurse for tonight. But before everything else, I would like to ask if you can understand me in English or do you want me to speak in Tagalog or in Cebuano?
English is okay, nurse.
Okay, I would like to ask what is your full name, ma'am?
Grace Antoinette Cadorna.
Your nickname?
Antoinette.
When is your birthday, ma'am?
October 16, 2004.
Great. So tonight, Antoinette will be assessing your breast and your axilla. So in this procedure, I will be touching some part of it. Would that be okay?
Yes, nurse.
And there are also procedures that you need to follow. Would that be okay?
Yes, nurse.
So if you feel uncomfortable or if you feel discomfort, feel free to raise your concern.
Okay, nurse.
Rest assured that all the data that we will be gathering tonight will be handed safely to the doctor. Thank you. Good evening, ma'am. I will ask you some question and you need to answer it honestly.
Okay, nurse.
So, have you do breast self-examination, ma'am? Do you have breast masses? Breast masses, ma'am?
No, nurse.
Okay. Do you experience any pain or tenderness in your breast?
No, nurse.
In your menstrual cycle?
No, nurse.
Okay. Do you experience any discharge from your nipple?
No, nurse.
Do you have medication history in regards with your breast?
No, nurse.
Okay. Do you undergo estrogen replacement therapy? Do you consume alcohol? Do you have high-fat diet, ma'am? So I can see you're not obese, ma'am. Do you use oral contraceptive?
No, nurse.
Okay. What is your age, ma'am?
17, nurse.
Okay. That's all, thank you. Next is we will inspect her breast for size, symmetry, contour or shape, while the client is in a sitting position. So next is we will inspect the skin of the breast for localized discoloration or hyperpigmentation, retraction or dimpling, localized hypervascular areas, swelling or edema. So based on my inspection, there are no discoloration, there are no retraction or dimpling, there are no swelling, and as well as edema. So next, we will emphasize any retraction of the breast by having the client to first raise her hands above the head. Next is to push the hands together while elbows are perplexed. And lastly, presses the hands down to the hips. So next, we will inspect the areola area, or this one. For the size, shape, symmetry, color, surface, characteristics, and any masses for lesions. So based on our inspection, there are no abnormalities in the size, shape, symmetry, color, surface, characteristics, and there are no found masses or lesions in the areola area. So next, we will inspect the nipples, or these. For size, shape, position, color, discharge, and lesions. So based on our inspection, there are no abnormalities on the size, shape, position, color, and there are no found discharges and lesions on the nipples. Next is we will palpate her axillary and the subclavicular lymph nodes. So ma'am, please do it. So based on my palpation, there are no abnormalities in her axillary as well as the subclavicular lymph nodes. Next is we will palpate the breast for masses, tenderness, and any discharge from the nipples. So based on my palpation, there are no abnormalities and Next is we will palpate the areola area and the nipples. So based on my palpation, there are no masses on the areola area and the nipples. So breast cancer is common among women in the Philippines. So there are estimated 1 in 14 women at the age below of 75 can develop breast cancer. So I will be teaching my client on self-breast examination. So ma'am, you can examine your breast by its visual appearance by putting your hands on the side in a neutral standing positions by looking through the mirror. So ma'am, you can start examining your breast by their visual appearance. So start by putting your hands in the side in a neutral position and looking through the mirror. So first, look for visible changes in front of the mirror. So first, abnormalities that we should find are the changes in the shape and size of the breast. So it should be symmetrical and the shape and size of the breasts should be the same with each other. Next is the dimpling or puckering of skin around the nipple, if there are puckering of skin around the nipple. The persistent rash or change in skin around the nipple, if there are redness in your skin. And next is nipple inversion, retraction, bleeding or discharge in your nipples, if there are bleeding or discharges from your nipples. Skin redness or soreness, if there are redness or soreness in your breast. Next is the accumulated veins on surface, if there are veins on the surface of the breast. And unusual swelling of one of upper arm. So if there are swelling here, you can experience swelling. Those are the visible changes that you should look in the mirror. So next ma'am, we can apply 2 positions in breast examination. So the first position is when you raise your 2 hands above your head or behind your head, like this. The next position is when you hold your hand on your hips and by tensing the chest muscles. So these two positions give us a more careful inspection for changes in shape and size of the breast, dimpling or puckering of skin or nipples. To find changes in your breast, underarms, and collarbone areas accurately, do so by lying down because the breast tissues spreads across evenly in this position. So, what can we look out for in this position, ma'am? So, we can easily look out for lump, swelling, or thickening in the breast and in the underarm area. We can also easily look for enlarged lymph nodes at the underarm and above the collarbones. So, ma'am, we can also examine your breast with the position of lying down. So, how do we examine breast when lying down? So, first you needed to place a folded towel or a pillow under the client's shoulder. So, we'll use it. And please lie down, ma'am. Next, ma'am, you need to extend your right elbow outwards and place your right hand under your head. Next, using your left hand, ma'am, use the pads of 3 middle fingers and apply pressure to feel breast tissue. So do it in a circular motion, ma'am. So, while doing that, ma'am, use the 3 varying pressure levels, which is the light, the medium, and firm pressure to feel from the skin levels to the tissues. Next, ma'am, you need to examine your breast systematically. So we will use it in a clockwise or anti-clockwise direction. So, what do you prefer, ma'am? Clockwise or anti-clockwise? Sige. Do it systematically. Okay. Next step, ma'am, is we need to press down over your nipples. So we will use the 3 pressure levels, which is the light, medium, and firm pressure level in a circular motion. So you need to touch your nipples, ma'am, and you need to press down in a circular motion. Light, medium, and firm. So, ma'am, to feel lumps on your underarm, we need to put your arms by your side. Then start in the hollow of the arm and towards the breast, using a circular small motions toward the breast. Yeah. Okay. So, ma'am, to check above the collarbone, you need to use light pressure above the collarbone and move in a circular motion. Sa collarbone po, in a circular motion. So, you need to repeat the same steps, ma'am, on your left side.
How often you should perform breast self-examination?
The best time to perform self-breast examination is about a week after the start of your menstrual cycle.